Hello and good evening, everyone. Welcome to our January webinar where we will be reviewing patient selection for the Ambulatory Surgery Center. For those of you who are not SAMBA members, please consider joining the society as it offers many benefits to the members. You can view a list of membership benefits on your screen now. Please visit our website, www.sambahq.org, to learn more about the benefits of membership. A few quick housekeeping notes before we get to tonight's presentation. Please note that this webinar is listen-only mode. As an attendee, your audio and video is turned off. On the bottom of your screen, you'll see two buttons, one that says chat and one that says Q&A. Please use the chat function to chat with other attendees during the webinar. However, please use the Q&A box to submit any questions that you have for our presenter. Dedicated time for Q&A will take place at the end of the presentation, but please submit your questions throughout so that we can prepare to answer. Of note, SAMBA is on Twitter, Facebook, and LinkedIn. Connect with us on social media to stay up to date with all things SAMBA. Now on to introductions. My name is Dr. Brett Elmore. I'm an assistant professor of anesthesiology at the University of Virginia Health. I'm also the associate fellowship director for the accredited Regional Anesthesia and Acute Pain Medicine Fellowship here at UVA. At this time, I would like to introduce tonight's main speaker, my colleague and mentor, Dr. Ashley Schilling. Dr. Schilling is an associate professor at the University of Virginia Health. She attended both medical school and residency at the University of Virginia. Her passions include regional anesthesia and acute pain medicine, ambulatory anesthesia, orthopedic anesthesia, and medical education. Her roles include medical director of UVA's Ambulatory Surgical Center, and the, division head of the Regional Anesthesia and Acute Pain Medicine and Regional Anesthesia and Acute Pain Medicine Fellowship Director. She serves on ASA's Regional Anesthesia and Acute Pain Medicine Committee, as well as the Society of Ambulatory Anesthesia's Regional and Education Committees. Over to you, Dr. Schilling.
Great, thank you so much. So I'm going to pull my slides up here. Okay. I'm really honored to be with you all tonight. I wish it could be in person. I'm hoping in the next year, we'll see each other's faces, but this is a topic that's really near and dear to my heart. I've been the medical director of UVA's Outpatient Surgical Center for 10 years. And one of my major jobs is determining patient selection. And I'm faced with lots of questions of, is this patient safe for surgery at our ambulatory surgical center? And so my hope tonight is that I can help you all to better understand the complex interplay between patient selection with facility limitations, the type of surgery, and then anesthesia choices. I also want to try to describe some of the patient characteristics that may increase their risks of having surgery at an ASC. And then I want to discuss some specific processes that can help guide patient selection. So I don't need to tell you all, since you are SAMBA members, ambulatory anesthesia is the most rapidly growing subspecialty in anesthesia. And there are, I'd say, more than 70% of all anesthetics administered are performed in an ambulatory setting. And so much has changed and improved to allow for that. We have better surgical techniques. We have more and better facilities. We have better anesthetic techniques, pharmacologically, better pain management techniques. We have more data to show that it's safe to do patients in an ambulatory setting. Patients want that. So many patients actually prefer to be undergoing surgery in an ambulatory setting where they're going home same day. And then there are obviously financial incentives for performing patients in an ambulatory setting. So the question is, how do we create a successful ambulatory surgical center? And I like to think of it as kind of falling into three categories, the most important being providing safe quality care, but also efficiency is critical, and then providing good cost of care. So when we want to talk